Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will honor October as Breast Cancer Awareness Month by talking with several local experts and also highlighting an upcoming event to benefit breast health locally. First, we will welcome Dr. Philip Kahn of Novant Health Coastal Plastic Surgery. Then, two new physicians to the area will join us, General Surgeon Dr. Max Beninati and OBGYN Dr. Nicholas Bodenheimer. Finally, Chris Crane and Victoria Bellamy of the Novant Health Foundation Brunswick Medical Center will join us to share information about an upcoming event, Glitz, Glamour, and Glow. Our first guest is Dr. Philip Kahn of Novant Health Coastal Plastic Surgery. Welcome to the show today, Dr. Kahn.
Thank you for having me.
It's such a pleasure to have you back here on HealthWatch. I know you were with us a short time ago, but for those viewers who may not have had the opportunity to see you, let's tell them a little bit about your background and your education.
Well, for medical school, went to East Carolina University. That was after my undergraduate degree at North Carolina Chapel Hill in health policy. Following that, I went and did full general surgery training, which spanned from Charlotte, North Carolina, Carolinas Medical Center, to Spartanburg, South Carolina. Then I decided to broaden that opportunity and go into plastic surgery. So I went to Texas at the Texas A&M Scott and White healthcare system.
Yes.
And then following that, I decided to do some extra cosmetic training and went back to Charlotte and trained there as well.
Wow. You've been a busy man.
Yes, I have.
Now, Dr. Kahn, I know we've known each other for many years.
Yes, we have.
And it's wonderful to have you back in Brunswick County. It's such a blessing for us. So why don't you share a little bit of what we've talked about with our viewers about why you came back to Brunswick County and why you made this your home?
First and foremost, like you said, it's home. It's where I was raised. It's where I came up, and I grew up around everyone in the area.
Sure.
I wanted to really, as many people know, my father and my mother provided health care here for over 35 years, and I wanted to follow in that footsteps. And I really want to give back in terms of service, as well as providing things like cosmetic type things for people in the area, things that are really needed, and give back to the community that gave back so much to us.
Your father was a huge being in this community. He did a great service for all of us, so we miss him. I know you do.
Yes, we do.
But again, I'm so glad that you chose this as your home. So tell us a little bit about Novant Health Coastal Plastic Surgery and the services that you're offering.
We are a full-service plastic surgery practice, which is, in saying that, means that we provide services for cosmetics, like things on the eyelids, on the face, on the brow, on the breasts and body, like tummy tucks and mommy makeovers. But what's unique about us as well is that we also provide in terms of reconstructive type procedures or treatment of conditions. That can be skin cancers that need to be closed and removed, and it can also be things such as reconstruction from breast surgery or any other type cancer.
Let's talk a little bit about the cosmetic procedures.
Yes.
Let's start there. So how does that all happen? How does the process start? I come to your office and what do we do?
You call the office for an appointment, you come in for a consultation, and we really sit and like to talk and hear all of your different needs of what you look for, whether that be your skin, whether that be your face, your body, your brow, or a combination of everything. Really to take time to get to know you and get to know what you're looking for. Once we do that, we come up with a plan in terms of what you would like and present options to you that you would like or that we feel are best for you. Some of those can include surgical options, but we have a wide variety of non-surgical options like Botox and fillers to help with that as well. We also provide a full skincare line. And I tell that to everyone. Taking care of the skin has to be the #1 priority in a lot of these things, and that can't be overlooked.
Yeah. So it sounds like there's a wide variety of things, and that first appointment would be a full consultation to
Yes.
talk about and just to get to know each other.
Exactly.
Good. Now, I think I heard that you're going to offer a Botox special
Yes.
in maybe October.
In the month of October, it's a really exciting time of year to get things done because the weather's changing and people like to change at the same time. And we're going to have some interesting specials going on for Botox as well as things such as Juvederm, which is a filler that can be used. That provides great techniques to treat those fine, annoying lines of the eyelids, things in the forehead, the frown lines, wrinkles around the face. It's just an exciting thing, and it's something that can be done same day, in and out, with not much downtime.
Relatively painless.
Relatively painless. There are a few very minor sticks involved, but it's a very nice procedure.
We'll talk about that offline.
Yes, we will.
Well, as you know, October is Breast Cancer Awareness Month, and so I wanted to take the opportunity to learn more about breast reconstruction and kind of the types of procedures that you offer. So let's kind of start with the basics. What exactly is breast reconstruction?
It's an excellent question. Breast reconstruction is a wide variety of procedures that have the goal of producing a breast that has form and symmetry again, following any type of a procedure.
Okay.
That could be most commonly a procedure that has the breast treated for cancer that leaves a deformity.
Yeah.
This can be something such as a lumpectomy defect, or it can be something such as a total mastectomy. But it also is something that's used for people that may have had issues with infections in the past, or someone who needs a procedure to correct a problem in the breast other than a cancer. Reconstruction has many possibilities for that as well.
And I understand that reconstruction can be done at different times. I know people years ago who had nothing done, and it seems like they're sort of left behind. Is there a solution for that?
Yes, most definitely there is. There are many types of, when we talk about breast reconstruction following cancer in terms of, let's say, a patient that's had a mastectomy. The timing of having a reconstruction can be either immediate or it can be in a delayed type manner, which is what you're mentioning now.
Right, yeah.
And it's a really exciting time because we have so many different options for patients now. In particular, I like to point out those patients who may have had a mastectomy 20 to 25 years ago who still feel they don't have options. We still have options for reconstructing those women now and really get them back to the natural feel that they had in the past and bring back what they had that's now gone.
Once the reconstruction occurs, what can a patient expect in terms of recovery and just getting back to being normal?
Typically, I tell everyone, depending upon what type of reconstruction is done and depending upon whether it's a combined immediate procedure or a delayed procedure, people may or may not have to spend one quick night in the hospital depending upon that, but normally the great majority of the time they go home the same day.
Really?
Typically people will be sore from muscle type tightness for a few days and then they're up to their old self in 3 or 4 days.
Wow, that sounds promising. Because I know I have friends who didn't have reconstruction many years ago and have really hated that. And now there are options for them. So I think in that respect it's a wonderful thing. And so I'm excited to hear that. So the surgeries that you perform, are they done at Novant Health Brunswick Medical Center?
Yes, they are. They have an excellent suite and an excellent team there with everyone involved from the time folks walk into the door until the time they leave. Really some of the top notch that I've ever worked with in my career. All of them are performed there. However, we do have some minor procedures such as skin lesions and things that we can do in our office as well for patients to make it more convenient for them as well.
And that would probably all be discussed during that initial consultation.
Yes. Yes, it is
awesome.
in that initial consultation. And people at that initial consultation can, if they so choose, go ahead and plan on surgery and book surgery at that time.
Really?
Yes.
Oh, great. Well, speaking of booking surgeries and what have you, tell our viewers where your office is located and how we might get in touch with you to make those appointments.
Our office is located off of Highway 17 near the Old Brunswick Hospital in Suite 5, Building 6. And the phone number to call to get in touch with my great staff is 910-754-8808, and they can help you at any time.
And I believe that is the very first office in that complex. It's very easy to find. It's right there facing 17.
It is. It's right tucked in the corner there. It's with a big sign at the front of it.
Great. And the parking's awesome. So,
yes, it is.
Yeah. Well, Dr. Kahn, it's such a pleasure to have you not only here on the show, but back in Brunswick County where you belong, back at home. So thank you so much for being here today, and I look forward to my appointment.
Thank you.
Our next guest today is Dr. Max Beninati of Novant Health Surgical Associates. Well, welcome to the show today.
Thank you very much. It's good to be here.
It's great to have you here. And I would like to start, as I do all my shows, with learning a little bit about the new physicians who are in town. So tell our viewers a little bit about your education and your background.
Okay. Well, I grew up in New York with very supportive parents who, who willed me through medical school in Erie, Pennsylvania, where the weather is a bit different from down here.
It sure is.
Yes, we get a little bit more snow up there. So that I went to medical school there, headed down to New Jersey for my residency training, for general surgery residency, and then finished up a fellowship over in Annapolis, Maryland.
Well, you've joined a great practice at Novant Health Surgical Associates. So let's tell our viewers a little bit about your practice and your partners.
Absolutely. So I joined 3 other physicians, Dr. Tillotson, Dr. Scallion, and Dr. DeSandre, where we offer a range of general surgery services as well as vascular. So I personally bring, with my fellowship in laparoscopic surgery, a emphasis on minimally invasive procedures and advanced laparoscopy.
We've had those physicians on our show before, and so we're very familiar with that group, and it is an awesome group.
Absolutely.
You're in great company there.
They've been very supportive and friendly, very welcoming. The whole office really has.
Yes, it is a great office. Totally. I love their staff. Now, I understand that Novant Health Surgical Associates has 3 locations. Is that correct?
Yes, we are mainly, the main office is in Bolivia, right next to the hospital. So if you know where the hospital is, you know where our office is.
Yeah, some people don't realize that's really Bolivia. Some people think it's in Supply, but our address is Bolivia.
Right.
So, yeah.
Right there off of 17.
Right.
And then we also have an office down in Sunset Beach. And then in
Southport, I think,
yes.
right? Or down on the, yeah,
Southport.
that's great. So it really covers a large portion of Brunswick County.
Absolutely.
Yeah, that's awesome. So let's talk a little bit about the services that you provide.
Okay. I do a range of general surgery, anywhere from breast disease to simple lumps and bumps to anti-reflux procedures. There's that's actually a big part of what my emphasis was on in fellowship, and I plan to bring here. Yes.
Oh, that's interesting. That's interesting. Your particular specialties or something that you prefer to focus on, do you have something that you really like to do better than others? Or?
Right. I love all the laparoscopic surgery. So I do a lot of hernias all over the abdomen, including diaphragmatic. I also enjoy colon surgeries for both benign and malignant processes, as well as, like I said, the anti-reflux procedures.
Well, that's great, Dr. Beninati. And as you know, this is October and is Breast Cancer Awareness Month. So in honor of that, I wanted to focus a little bit on breast health issues. And so let's talk a little bit about the procedures that you might perform or offer for breast health.
Sure. So in the office, we're able to do our biopsies, either in the office or in the hospital, which is very convenient for the patients.
Right.
We also perform the range of lumpectomies, mastectomies, and a lot of times we work in concert with Dr. Kahn, the plastic surgeon, and we're able to do the reconstruction either immediately at the same time or thereafter.
Oh, yes. He talked about, he was on their show also, and he talked about breast reconstruction like after the fact. I think that a lot of it's done right at the time of the mastectomy, but there are options for later.
Right.
So,
yes, exactly.
That's really good. So if a woman finds a lump on her own, can she just call Novant Health Surgical Associates and schedule an appointment for an examination?
Absolutely, yes. We have a wonderful front office staff, and
you do.
And it's Heather and Melanie there. Wonderful ladies and very receptive. So if someone were to call the office, they would get you plugged in right away. And we actually have, we place a lot of importance on that lady being seen very quickly, or men. Men can get it too.
True, that's true.
But,
do you need a physician referral to get an appointment?
usually not, but the office can help navigate that system too. So I would say just call the office phone number, which is 910-721-4000, and then they would help direct the person to the appropriate referral pattern or just seeing us directly.
So if their particular insurance carrier or their plan required that, either Heather or Melanie would help them navigate that process.
Yes.
That's awesome. So, Dr. Beninati, if I were to come into your office with a concern, like I had found a lump in my breast or really anywhere, and I was referred to your office, tell me what it would be like for me in terms of next steps.
Right. So you would call the office like we talked about. You would come in. We would make sure that the proper imaging was done, which we can perform over at the hospital. And then if any procedures needed to be performed thereafter, we can either do the biopsies and the further resections and reconstructions all at the hospital.
And you would help arrange that?
Absolutely.
Your office would help me navigate that through that system.
Yes, it's a fantastic office. So
yeah, I know.
Very friendly.
So then I would say that much, if not all, of the care could be done right here in Brunswick County.
Yes.
There would be no need to go outside of Brunswick County for that.
Right, and that has been one of our focuses, to be able to really provide a centralized location to help serve Brunswick County.
Wonderful. Well, I can't thank you enough for being here today. It was a pleasure to meet you and to introduce you to our community here in Brunswick County. We're so happy that you're here. And tell us, before we wrap up, remind us one more time how we make an appointment with you.
No problem. So you can call our main phone number, 910-721-4000, and speak with one of our ladies there, and they'll get you plugged in.
Great, great. Well, thanks again for joining us today. It's been a pleasure.
Thank you
and
for
I hope to
having
talk
me.
to you soon. After you've been here for a while, I'd love for you to come back,
I'll be back.
And tell us how it's going.
Thank you.
Thank you. Now we will welcome Dr. Nicholas Bodenheimer of Novant Health OBGYN. Well, welcome to the show today, Dr. Bodenheimer.
Thank you.
It's a pleasure to have you here. And we'll start off by the way we start most shows, by sharing information about education and background. So tell me a little bit about yourself and your schooling.
Myself, I'm originally from High Point, North Carolina. It's about 3 hours west of here.
Yeah.
I have one brother. He's 4 years younger than me. He's a lawyer in Miami.
Uh-oh.
Yep. We have a lot of good conversations.
I bet you do.
We do. I went to undergraduate college at Gardner-Webb University in Boiling Springs, North Carolina.
Right.
It's about 45 minutes southwest of Charlotte. From there, I went to graduate school in Omaha, Nebraska at Creighton University and got a Master's of Science in Anatomy. From there, I went to Blacksburg, Virginia, and went to medical school at Virginia College of Osteopathic Medicine. And then most recently, I finished residency at New Hanover Medical Center in Wilmington in obstetrics and gynecology.
Wow. So you've been in this area a while then.
I have.
You're kind of used to the coastal living.
Absolutely. And I wanted to stay here too.
I'm sure.
Absolutely.
I'm sure. And we're happy that you chose to do that, especially that you chose Novant Health.
Thank you. I'm happy to be here.
Well, we've had some of your partners at Novant Health OBGYN on the show in the past, and they are a wonderful group. You have a great office. So remind me exactly who your partners are and where your offices are located.
Dr. McCarthy, Dr. Shue, Dr. Toller, Dr. Thompson, and then Sarah Brown's our nurse practitioner. And we have offices right beside the hospital in Bolivia, one at Sunset Beach, and one in Leland.
Now, I understand that you provide a full range of services from babies to menopause and on after. Is that correct?
Absolutely.
Well, no, in all seriousness, tell us a little bit more about the services that you do provide and any special clinical services that you're really interested in?
Absolutely, yeah. As far as the services we provide, obstetrics is a part of what we do, but we
Right.
also provide a comprehensive range of gynecologic examinations and treatments there too. So anything ranging from abnormal bleeding, menopausal symptoms,
Yeah.
breast masses, pelvic organ prolapse, we can treat. And we offer medical as well as surgical management for those. My special interest, it lies in urinary incontinence, pelvic floor surgeries, as well as minimally invasive surgeries like the robotic surgeries.
Since this is October, we're taking a little bit of time in each of our segments today to talk about breast health with each of our guests. So as an OB/GYN, you must field a lot of questions about breast health.
Absolutely, absolutely.
Let's talk about a little bit about that. What kind of questions do you get?
The most common ones is breast pain and then breast lumps. And so when a patient comes in, it's important to kind of characterize what exactly she's experiencing. With the breast pain, is it everywhere, or is it in one particular region? Is it on one side? Is it on both sides? Does it come with the menstrual cycles? Is it cyclic? So all those are very important things to keep in mind when you're discussing breast issues.
I'm curious about self-exam, breast self-exams. It seems to go back and forth. They want you to do it, then they don't, and how often and what time of the month and all that kind of thing. Could you address that a little bit?
Absolutely. So depending on what society you look at, the recommendations differ.
Oh.
So we followed the American College of Obstetricians and Gynecologists, their recommendations. And their recommendations are for mammograms, it's every woman every year starting at 40, okay?
Okay.
For a clinical breast exam, which is what we do, it's women aged 20 to 39 every 1 to 3 years, and then every year for women over 40. They've moved away from the self-exams, and what they're saying now is more self-awareness. And what that means is you're...
Yeah, what does that mean?
So I'm getting ready. So what that means is you're more in tune to kind of what's natural for you.
Okay.
So whether you have cystic breasts or this abnormal tissue in one breast that you've noticed that's been worked up, you know what's normal for you. What's interesting is that for women over 50, about half of them pick up breast cancer themselves as they're doing their own, self-awareness.
Right.
And for women over 50, it's about 3/4 of women pick it up by themselves. So now it's just more knowing what's normal for your body.
And just, I guess, kind of watching for those changes.
Exactly.
Something out of the ordinary.
Exactly.
That's interesting. So, say I discovered a lump myself. So, what's your recommendation? Do I call you? Do I go to my primary care? Or all the above? Any of those?
You can, it's good to come see us, I think. We specialize in women's health overall. So if you find a lump and you're worried about it, like I said, get an idea, be able to characterize it. Where is it at? When did you first start noticing it? Any pain associated with it? And come see us. And then we'll talk to you, examine you, and then order any further workup that's necessary.
And I know that you are aware that the hospital currently has the Susan G. Komen funds available as well as the breast health funds. And do you want to talk a little bit about those funds and how those are available to underinsured women?
Absolutely, yeah. So, our big goal is we're here to help, and we're
Right.
here to serve the community, and we don't want the lack of insurance or anything
Right.
to get in the way. So with women that need mammograms and screening mammograms and diagnostic mammograms and so forth, they can get in touch with us, and then we have these funds available for them.
Great, that's awesome. Yeah, the most important thing is to get care for those
Absolutely.
who need it, and getting the word out that those funds are available.
Right.
So I'm sure that your office can help with spreading that word.
Absolutely, we try.
Yeah. Well, this is all great information. Thank you so much for being here.
Absolutely.
We're so happy to have you in Brunswick County. And can you remind our viewers how to get in touch with you and how they might make an appointment?
Absolutely. They can call our main office for new patients and schedule an appointment. If they're already an established patient, you can call the office or go through My Chart and make an appointment with us.
Oh, that My Chart's wonderful, isn't it?
Absolutely.
We love that. Well, thank you again for being here today.
I'm happy to be here.
And we look forward to hearing back from you after you've been here a while.
It was a pleasure.
Thank you. Our final guests today are Chris Crane and Victoria Bellamy of the Novant Health Foundation Brunswick Medical Center. Well, hey guys, welcome back to the show.
Thanks for having us.
Great to be here.
Well, it's a pleasure, and you know how much I like working with you guys, and so let's just get right to the heart of it. And I know you've got an event coming up, so who wants to start?
I can start.
Good.
We do. We have Glitz, Glamour, and Glow,
Yep.
and that is coming up on Saturday, November 14th from 1 to 4 p.m., and it's going to be in a new location this year at the South Brunswick Island Centers, which is right off of 17, and that's in Carolina Shores.
Carolina Shores.
Yep.
Well, Chris, tell me about what's going to happen at Glitz, Glamour, and Glow this year.
Well, it's a great space, and we're looking forward to some of our fashion partners returning, as well as adding some new faces to the event. And there will be plenty of wine.
Oh, let's get to the good part. Wine and food, right?
Wine
and
and
food.
fabulous food. And everything a woman could ask for. Shopping, food, wine,
Beauty secrets?
secrets.
All that kind of stuff.
Absolutely.
So you say some of the vendors will be returning, and some new ones, hopefully, huh?
Oh, yeah.
Oh, that'll be fun.
Yep.
And tell me about the benefit. Who will benefit from this year's Glitz, Glamour, and Glow?
Okay, well, the benefit is our Breast Health Fund with our foundation, and so that helps to provide mobile mammography for Brunswick County.
Right.
It also helps to provide financial assistance, and it gives to the Brunswick Pink Angels, and they provide comfort items for women that have just recently...
They make those pink bags, don't they?
Recently diagnosed for breast cancer.
That's awesome, awesome. One of our other guests, we were talking about those funds and how much they're needed here in Brunswick County, and we need to get the word out about having the breast health funds or the Susan G. Komen funds available for those women. So that's great. Yeah. Let's talk about the tickets. How much are the tickets this year?
Tickets are $35.
Okay.
Or we have a girlfriend's package, so you can get 6 tickets for the price of 5.
So, like, buy
Bring your
5,
friends.
get 1 free. Or that's what it is. Well, great. How about sponsorships? Do we still have sponsorships available?
We do. We still have several levels available. You can sponsor at the $1,000, the $2,500, or the $5,000 level. And we are taking calls at this time. So call us and let us know if you would like to be an event sponsor this year.
Good. And I suppose we'll start seeing the things in the newspaper and flyers and all that kind of stuff coming out.
Oh, yeah.
Pretty soon. Well, good. Well, let's talk about the event again and where it is and the time and stuff like that. So we make sure we're there on time.
Okay. It's called Glitz, Glamour, and Glow, and it will be held November 14th from 1 p.m. to 4 p.m., and it will be held at the South Brunswick Island Center off of 17 in Carolina Shores.
Victoria, is there a website or phone numbers that we can call?
Sure. The website is www.novanthealth.org/Brunswick events. And then for sponsorships or tickets, you can call either me or you. So my number is 910-721-1473. And then your number is 910-721-1030.
Oh, that's funny. Yes, they can call us at any time, and we'll be happy to get them tickets or help them with sponsorships or whatever. So I think it'll be a great event this year. I'm really looking forward to it.
It will be fabulous. Everything that a woman could ever desire right
Yeah.
there.
A
Shopping.
girls' day out.
Yeah, a much-needed girls' day out for a wonderful, wonderful cause.
Yeah, and that's what it's all about. It's
Absolutely.
the cause.
It is.
The breast
That's why we're
health
doing
fund.
it.
Yeah, that's why we do what we do. So, well, thank you, ladies, for being here today. It was an awesome interview, and I'm excited. So let's sell tickets.
Yes.
Yes, we are too. Thanks for having us.
You're quite welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.